Hello, hi, this is Dr. Shahid Rashid Soor, and today we're live from Esther Clinic, Knife Dera. First of all, I'm sorry that we are almost 20 minutes late. There was some technical snag with the live thing, but I'm sure you're there and you're waiting. So, yes, here we go. Today, I'm here to talk about the oral cavity in general and the oral diseases and the oral hygiene in particular. So what is I will try to brief myself a little bit here that I will not use the medical terms because it's for the information of the general public, and I hope you understand, and I hope and I wish that the people who are listening us live here today, they will get some knowledge about the general oral health. So let's talk about what is an oral cavity. So that is, I'll have I have divided the discussion, the talk into 3-4 segments. So in those 4 segments, it's for the better understanding of all of us. So the first topic will be what is an oral cavity. Yeah. So oral cavity. When we talk about when we talk to anybody walking the street, or anybody, a common man, that what does a dentist do? And his answer will be that a dentist treats your teeth. Oh, that is so unfortunate that people do not know that what a dentist can do. Now, a dentist is not there only to treat your teeth. They are there to treat the whole of your oral cavity actually. Now, what is in the oral cavity? It is the teeth, of course, 32 more or less. Yeah, there can be more teeth, more than 32. They are called supernumerary, and recently I saw a case with almost 37, 38, 36, 37, 38, 39, 40 teeth. Yeah, they can be more. So, oral cavity encompasses the teeth, the tongue, the inner lining of the oral cavity, that is the inner side of the cheeks from both the sides, then the floor of the mouth, underneath your tongue, then it is the tongue, then it is the roof, also called as palate. So any disease, and gums of course, which I forgot, any disease which affects any of these structures, that disease can be well treated by a dentist. A dentist does not treat only cavities, he does not fill and drill and take out the tooth, but he does all other things. Like we have oral cancers, it can be treated by a dentist. Yeah, of course, an oral and maxillofacial surgeon who essentially is a dentist. There are other problems associated with the oral cavity. A lot of them are there. And who treats them? A dentist. Of course, a dentist. So now what is an oral cavity? Oral cavity encompasses all these structures, what I told you. It's not just the teeth. So how do we take care about it? What is it? How can we detect it? Let's move on. So what is oral health? Now we came to know about oral cavity. So let's talk about oral health. Well, oral health, we have a lot of definitions. A lot of definitions are there, but the most common and the most recent, which was published in 2016, that is a couple of months back, by WHO, is that oral health is the absence of any disease. Alright, so it is the ability to chew, to talk, to smile, to swallow, to eat, to express facial emotions without any discomfort, pain and disease. So this is in simple words, they have encompassed, they have got everything into it, and it is for the easy understanding of everybody that if you have pain, you don't have a good oral cavity, you don't have a good oral health. If you have, let's say, sensitivity, you don't have a good oral health. If you have pain on chewing, you don't have. If you have a mouth ulcer, okay. If you have a CA, carcinoma, God forbid, people have it, right? And they are the most common cancers of this region, right? Oral cancers, because of smoking and tobacco chewing and a lot of other factors. So all these diseases, all these factors, which which anti this definition of WHO, that means that a person does not have the proper oral health. Now, how do we say that our health or oral health is a good health or it is unhealthy, it is bad health? So number one, that we have pain, we have sensitivity, we have pain on chewing, we have bad breath, we have bleeding on brushing, we feel sensitivity while having cold water or ice cream or hot coffee. We cannot enjoy our hot coffee. Oh, that's a dangerous thing. And a lot of other things which hamper your daily routine activities, in the oral cavity. They can be called as the factors or the diseases which affect your oral cavity. So when do you see a dentist? Normally you see a dentist. Very unfortunate that you see a dentist only when you get pain. You see a dentist only when you get pain. But that should not be the case. That is a wrong perception that when you get pain, you go to dentist. Okay, fine, he'll treat it. But no. You should visit your dentist between 6 months to 1 year to 1.5 years, depending upon the condition of your oral cavity, and it is the dentist who will tell you how often you have to visit him. Okay, so in children it may be less, say 6 months. In adults it may be more, from 18 to say 60 years or 50 years. You have to visit every year. You have to get a scaling done every year, depending again on your oral health, of course. So how often do we visit a dentist? If I ask the people around me, I'm sure that most of the people who visit the clinic, they go to the dentist, only when they get pain. Or some of them are in their late 40s and they very proudly say that, oh, I have never visited dentist, it's my first time. But that is not the thing. It's not something to boast about. But a common practice should be that you should visit your dentist as often as you could, say once a year at least. And a dentist will recognize, he has the ability, he has the knowledge and capacity to recognize and diagnose your problem. He can very well tell you what the problem is, what the treatment plan is, and how much time it's going to take, and how we're going to treat that thing, So if you want to save your money, if you want to save your time, if you want to, be away from the pain, dental pain, which is very, very painful, I should say that, very painful. So you should visit a dentist often. So now that is when you should visit a dentist. Now the common problems which we encounter in the clinics is that of the tooth cavity, a rot in the tooth or a tooth cavity. That is the common. Unfortunately, very unfortunate that 92% of the population of the world has a cavity. It's huge and alarming that 92%. And let me tell you one thing more, that unfortunately that it is seen nowadays, the trend is that the people who have good income and the people who are wealthy and educated, they have more cavities. Now why it can be, why is it? Or eating habits have changed over time. In last decade, in last 10-12 years, they have changed drastically. So we have this junk food, we have untimely food, we have a lot of things available in the market which were not there before 10 years, right? So all these habits associated tend to increase the cavity, increase the tooth decay or tooth rot. So I should say that these people who have different oral habits, they should visit the dentist often than the normal. So next is, how do we recognize a tooth rot or a tooth decay or a tooth cavity? Now what is a tooth cavity? So we have teeth all around, up and down. See, I don't have a model here, but I have a cast of a patient. See, these are the teeth, right? So here we open a mouth like this, okay, and we close them. So this is the upper, this is the lower jaw, and we have the teeth, and this is the upper jaw. Now it's trimmed a bit, not worry about that. We're talking about teeth here, okay? So this is the upper jaw. So how do we check ourselves at our home? That is there any dental problem with us or not? Now what we do is, the common practice is that after every say 6 months or 4 months or 5 months, we have to go in front of a mirror and we have to open our mouth and we have to check for any black or brown spot on a teeth. Get a mirror, normal, you can do it at home anytime. It takes just a couple of minutes, not more than that. It doesn't require you to get anything from the market, expensive thing from the market to check. No, just a mirror, it's there in your home, and you should be able to see, of course. So you open your mouth and check your teeth if you have any rot, if you have any black dot in your teeth. And if you have a black dot in your teeth, then what you do is, you try to brush, alright? Once you brush and you see that this black thing did not go off. It did not, it is still there. So what you do is, you should visit a dentist, because that black thing, again I'm showing you a model here, okay? These are the teeth, this is the gum, alright? So you can see this black thing here, that is what I'm talking about. This is the cavity, okay? So what is a cavity? If we see the cross section of the same thing, this is, cut hair. So this is the tooth, these are the roots, this is the back tooth, alright? Back tooth, molar tooth. So these are the roots here, and this you can see the black thing, this is the cavity. So this is a decay. What is a decay? It eats up a portion of your tooth, and it goes in until it reaches the pulpal tissue. And once it reaches the pulpal tissue, then we have only a couple of treatment modalities, treatment options left with us. Number one is root canal treatment, and number two is the extraction. Alright. So if you want to save your tooth, then whenever you find a black thing on your teeth, you have to go to a dentist to get it filled, to get it treated as soon as possible. So that's about it. Now next thing, that is the main thing of our topic here, that is about oral cleaning. Now how do we keep our oral cavity clean? Is it only the teeth we have to keep clean, or is it the tongues and associated structures also? Let's talk about that. So as we talked about the oral cavity first, right? So you have to consider all these things: your tongue, your lower jaw, your upper jaw, your floor of the mouth, your roof of the mouth, your cheeks from inside, your gums, and everything, including the teeth. So when I talk about oral hygiene, I do not only talk about teeth. Remember that and keep that in mind. We have been brushing all our lives, morning and evening. Most of the people brush in the morning, which again is not a good practice. It is said, and it is it is a fact now. It has been established that if you brush in the evening before going to bed, it is more helpful than brushing in the morning. Because what happens overnight is, when you have your food, debris of your food will get stuck on your mouth, and then you go to sleep, and the pH of your mouth, it alters during the night, and then the bacteria, they influence, they act, and then there are more chances of bad breath, of tooth decay, of bleeding gums, of swollen gums, of puffy gums, and lots of other things. So I was talking about how to clean the oral cavity, how to clean your mouth. So again, I will show you, this is a brush, a common brush available. And now, we have two kinds of brushes, or many kinds of brushes available in the market. And all the brushes are over-the-counter brushes. You need no prescription for that. You can go to the counter and ask for the brush. For a particular brush of your brand, of your choice, you can get it. So this is a manual toothbrush. It is a pedo brush for kids, but for the illustration purpose, I'm going to show you with this. So this is a manual brush. So a manual brush is for the person who has a good muscle power, who has a good muscle power. Let's imagine a person whose hand is not working. He has some ailment, with his muscles, with his dexterity of the muscles. So he cannot brush properly, right? He cannot brush. For that person, there are special brushes available in the market, They are motorized brushes. They are motorized. You have to just switch it, and it will just move. You just have to keep it in mouth, it will do its work. No need to and fro, up and down, circular, no motions needed. Alright. So we have manual brushes and we have motorized brushes. Okay. First talk about brushes. So manual brushes, how do you brush? This is again the model I'm showing you. So here. So how do you keep your brush? This is a brush. What is the normal practice of brushing? We do like finish. No, that is not it. This is not how it should be. Now this is a brush, this is your upper jaw, right? The front upper teeth, these teeth, okay? So you keep your brush at an angle of 45 degrees to the gums. 45 degrees. Remember, it has not to be straight. It has not to be like this. This also it has to be. But here, in the front portion, it has to be at the angle of 45 degrees. Alright? And you have to do small circular motions. Small circular motions all around. Here, 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 everywhere. Front side of all the teeth, brush at 45 degrees, circular motion. That's done. Now open your mouth. Down also the same thing. Brush at 45 degrees, round, round, round. By the way, it's called as modified Bass method, okay, to tell you. So from inside, again the same thing. And yeah, when you finish this portion, right, you're brushing the front teeth, okay, when you finish it up, then you have to give a stroke like this, down, a stroke down, a stroke down, a stroke down, you know, to clean all this gingival margins. They are called gingival margins, the space between gum and the tooth, okay, these spaces between gum and tooth, the pink and white part where they separate, okay, you have to give a down motion. Same ways, 45 degrees circular motion, 45 degrees circular motion. Try to do it like this. Try to do it like this. So you have to remember while brushing your teeth that we have 32 teeth, and each tooth has how many surfaces? Let's count. 1, 2, 3, 4, and 5. So we have 5 surfaces. And do we remember it while brushing? I'm sure most of us do not remember that we have 5 surfaces in our teeth and we have to clean each surface equally. But what we do is, we do the front, that's fine, that's good. So how much pressure you should apply and for how much time you should be able to, you should brush your teeth. Yeah, about the time there are different views actually, but most of the dentists agree on the fact that 2 minutes of time while brushing should be enough. And the pressure which you apply while doing a manual brush, it should not be more than, you know, you write and you hold a pen, how much pressure you apply, almost the same pressure is to be applied. It doesn't have to be very harsh on your teeth, it has to be very gentle, circular motion, very gentle, 45 degrees, okay? So that is about brushing. 2 minutes, let me just, you know, give you the points. 2 minutes, 45 degrees to the gum line, pressure, same pressure as holding your pen, okay, and make sure that you brush all the teeth equally, alright, all the teeth equally. Don't just brush in the front portion, and no, that is not done. Now, do we only brush your teeth? No. We brush your gums also. Now how? When we brush, we have to extend the brush up. So we have to brush the gums, because whatever food you eat, it gets broken, you know, with mastication, alright? It's called mastication. It gets broken into minute particles. So these particles do not only stuck around your teeth, but they stuck around your gums. They get stuck to your tongue. They get stuck everywhere in your mouth. They do not have a particular place to be stuck on. So you have to brush your gums also. Now how do you clean your tongue? How do you clean your tongue? Now okay, fine. Let me come to this. Let's finish the tooth part first. Now there is this area you may ask that how do we clean this surface, because there are 2 teeth opposing each other, and in between, how do we clean that? Yeah, that is a question. So we have other aids available in the market. The most common, you know, cleaning dental aid is a dental floss. You might have heard of a dental floss. I don't have it here, otherwise I will show you. It's a thread-like thing, okay? You have to wrap it around your finger, around another finger, and then you have to insert it like this inside your mouth. Then you have to do these motions. In between your teeth, you have to put it, and you have to clean the surfaces. Okay, so now in market there are some other flossing aids which they have that, you know, you can hold them in your hand, no need to wrap around your finger. You can just put them in your mouth and just do like this and clean it off. You know, that way also you can do it. So floss, okay. So number 3 is interdental brushes. Interdental brushes are available in the market, which most of us do not know. Then we have mouthwashes, you know, mouthwashes which we can do on regular basis, day-to-day basis, not the medicated ones of course, the mouthwashes which we can do on regular basis. There are a lot of that in the market available right now. Yeah, there is tongue cleaners, you know, tongue cleaners are present there, tongue cleaners. So what you do is they clean the upper surface of tongue. Be sure not to, you know, scratch it more so that you get bleeding and you get ulcers in your tongue. You have to be very gentle, clean your tongue, because a lot of bacteria that accumulate on your tongue, and you will find it once you clean your tongue. You will find that yellow color slimy thing coming out of your tongue, which is very bad. It gives you very bad breath, and the taste of the food, you will not enjoy it. Once your tongue is clean, you will tend to enjoy the food as well. So that is about how you clean your teeth. Now, let us conclude, because it's been already 15 minutes since we are on live, and I hope, could you please check that if we have any questions coming online, if we can answer a few of them if there are any. So,
This Fatima Moise, she wants to know the good toothpaste for 18 months kids.
for 18 months kids.
Yeah.
Okay, I tell you, there is no good or bad toothpaste in the market. It's all your experience, okay? It's all the brand, what sells, okay? So you should not go with the brand. You should try a couple of them, say 2-3 of them. But the main question about 18 months baby is how much toothpaste you use. It's not the quality of the toothpaste what matters here. It's the amount and the time duration, okay? So, you know, a peanut, Fatima, it's for you. You have asked this question. Yeah, a peanut size toothpaste you have to put for him. It's not the full size, okay? This is the pedo brush for kids. You can see this. So you have to put a peanut size of toothpaste on your brush, and you have to assist your kid. You know, he has to learn the technique of brushing. You know, he has to learn it. So it is you who will teach him the brushing technique. All right. So it is not the quality of the toothpaste what matters here, but it is the quantity and technique of the toothpaste what matters. I hope you got the answer. So yeah, we have a few more questions, but I think we're short of time now, and we'll be finishing this up. So yeah, you can always catch me here. I am at Esther Medical Center, Knife Dera, for all the dental treatments, and we promise that we'll treat you well. Bye-bye.